Nocturia is a condition where an individual wakes up during the night one or more times to urinate. While it may seem like a minor inconvenience to some, its impact on health and well-being can be significant. Sleep is a crucial time for the body to rest, repair, and restore itself. When this cycle is interrupted, especially on a regular basis, it can lead to daytime fatigue, decreased concentration, irritability, and even a weakened immune system. Many people don't realize that waking up frequently to urinate isn't always a normal part of aging. It can be a sign of an underlying issue that deserves attention. The causes of nocturia are varied and often involve a combination of factors. These can include excessive fluid intake in the evening, consumption of diuretic substances such as caffeine or alcohol, or underlying health conditions like diabetes, urinary tract infections, bladder dysfunction, or even sleep apnea. In some individuals, hormonal imbalances can also contribute to this issue. For example, as we age, the production of antidiuretic hormone ADH, which helps the kidneys control the amount of urine produced at night, may decrease. This leads to more urine being made during nighttime hours, resulting in disrupted sleep. In men, nocturia may be linked to benign prostatic hyperplasia BPH, which causes the prostate to enlarge and press against the urethra, making it more difficult to empty the bladder fully. This leads to more frequent urges, especially at night. In women, bladder weakness or pelvic floor disorders after childbirth or due to aging may contribute. Additionally, poor lifestyle habits like high salt intake or lack of physical activity may play a role in aggravating nocturia. It's important to understand that nocturia is not a disease itself, but a symptom of something deeper. That's why identifying and addressing the root cause is key to finding relief. Left unaddressed, it can lead to a reduced quality of life and may even increase the risk of falls or injury in older adults who wake up frequently in the dark. With a combination of medical guidance, dietary improvements, and nutritional support, many individuals can reduce or even eliminate nocturia and enjoy more restful, uninterrupted sleep. Vitamins play a fundamental role in maintaining the overall health of the body, and this includes supporting the proper function of the bladder and urinary system. The bladder is a muscular organ that stores and expels urine. Its function depends on the coordination between muscles, nerves, and various biochemical processes, many of which are influenced by key vitamins. When there is a deficiency in certain essential nutrients, it can lead to imbalances that affect how the bladder operates, potentially contributing to issues like increased urgency, frequency, or nighttime urination, also known as nocturia. Some vitamins help reduce inflammation in the urinary tract, which is critical because chronic inflammation can irritate the bladder lining and lead to frequent urination. Others assist in strengthening the muscles of the pelvic floor and bladder, which is especially important as we age. Over time, the strength and elasticity of these muscles may decline, and without proper nutritional support, they may not function optimally. This can result in a reduced ability to hold urine, leading to more frequent urges even during the night. Certain vitamins also play a role in supporting nerve health. The bladder relies heavily on a healthy nervous system to signal when it's time to store or release urine. If these signals are weak or misfired due to a lack of essential nutrients, it can lead to bladder dysfunction. Additionally, some vitamins are involved in hormone regulation, and hormones such as the antidiuretic hormone are critical in controlling the amount of urine the kidneys produce at night. A well-balanced intake of the right vitamins can support the natural rhythm of urine production, allowing for better nighttime rest. Furthermore, antioxidants found in some vitamins protect the bladder and urinary system from oxidative stress and damage caused by free radicals. This kind of cellular stress is known to contribute to tissue irritation, inflammation, and aging, all of which can compromise bladder health over time. By maintaining sufficient levels of these nutrients through diet or supplementation, individuals may support the health and function of the bladder, leading to fewer interruptions during sleep and improved daytime quality of life. It's important to note that while vitamins are not a cure on their own, they form a critical part of a natural, supportive strategy in managing bladder-related issues like nocturia. Used alongside healthy lifestyle habits and under medical guidance, the right vitamins can help improve bladder control, reduce nighttime urination, and promote overall urinary wellness in a safe and non-invasive manner. Vitamin D is widely recognized for its essential role in maintaining strong bones, but its influence extends far beyond skeletal health. One of its lesser, known yet critical functions involves supporting the urinary system, particularly in regulating muscle strength and hormonal balance that directly affect bladder control. For individuals suffering from frequent nighttime urination, also known as nocturia, maintaining healthy levels of vitamin D may offer significant relief. This is because vitamin D contributes to several physiological processes that help the body retain urine overnight and reduce the need for multiple bathroom visits during sleep. One of the most important ways vitamin D supports urinary health is by aiding in the regulation of a hormone called antidiuretic hormone ADH. ADH plays a key role in controlling the amount of urine the kidneys produce, especially at night. When levels of ADH are optimal, the kidneys slow down urine in production while we sleep, helping us maintain uninterrupted rest. However, when vitamin D levels are low, this balance can be disrupted. The body may not respond to ADH as effectively, or ADH secretion may be reduced, leading to increased urine production during the night. This hormonal disruption is one of the reasons why people with vitamin D deficiency often experience nocturia. Beyond its hormonal role, vitamin D also plays an important part in supporting the strength and function of muscles, including the smooth muscles that surround the bladder and the pelvic floor muscles that help control urination. As we age, muscle tone and strength naturally decline, and when this affects the muscles involved in bladder control, it can lead to more frequent urges to urinate, urgency, or leakage. Vitamin D helps maintain muscle integrity by supporting calcium absorption and muscle cell function, which is vital for voluntary control of the bladder. With better muscle function, the bladder can hold urine more efficiently, reducing the likelihood of nighttime awakenings due to urgency. Vitamin D also has anti-inflammatory properties, which can be beneficial for individuals who experience irritation or inflammation in the bladder or urinary tract. Chronic inflammation can sensitize the bladder and lead to increased frequency, even when the bladder isn't full. By helping to reduce systemic inflammation, vitamin D may help calm an overactive bladder and allow for more restful sleep. Sources of vitamin D include sunlight exposure, fatty fish like salmon or mackerel, fortified dairy products, and egg yolks. However, many people do not get enough from sunlight or food alone, especially those who live in areas with limited sunlight, spend a lot of time indoors, or have darker skin tones. In such cases, a high-quality vitamin D3 supplement may be recommended. It's always best to have your vitamin D levels tested by a healthcare provider before beginning supplementation, as this ensures you take the appropriate dose for your body's needs. Incorporating adequate vitamin D into your daily routine, whether through food, sunlight, or supplements, can be a powerful yet simple step in reducing nocturia. When paired with other healthy lifestyle practices, maintaining proper vitamin D levels can help restore hormonal balance, strengthen bladder, supporting muscles, and contribute to fewer nighttime interruptions, ultimately leading to deeper, more restorative sleep. Vitamin B12 is a vital nutrient that plays a central role in maintaining healthy nerve function, and its importance becomes especially evident when it comes to bladder control. Many people dealing with frequent nighttime urination or nocturia may not realize that a deficiency in vitamin B12 could be contributing to their symptoms. This essential vitamin supports the nervous system by helping to produce and maintain the protective coating around nerves, known as the myelin sheath. When B12 levels are low, the communication between the brain and the bladder can become impaired, potentially leading to symptoms such as urgency, frequency, and poor control over urination. The act of urinating is not just a simple muscular process. It's a carefully coordinated activity that involves both voluntary and involuntary nerve signals. These signals tell the bladder when to store urine and when to release it. When nerves are damaged or not functioning properly, the messages that signal fullness or control the timing of bladder emptying can be delayed, weakened, or even misfired. This can lead to an overactive bladder, frequent urges, and waking up multiple times during the night to urinate. A deficiency in vitamin B12 can worsen or even trigger these symptoms, especially in older adults, who are more prone to both nocturia and B12 deficiency due to reduced absorption with age. In addition to its impact on nerve function, vitamin B12 supports red blood cell formation and energy production, which can improve overall vitality and support healing and recovery within the body. Low B12 levels have also been linked to neurological issues like tingling in the hands and feet, fatigue, mood disturbances, and cognitive decline, all of which can indirectly affect sleep quality and stress levels, further complicating bladder health. When the nervous system is under stress or malfunctioning, it can heighten sensitivity and responsiveness of the bladder, making even small amounts of urine feel urgent. The sources of vitamin B12 include animal-based foods such as meat, eggs, dairy products, and fish. For individuals following a vegetarian or vegan diet, fortified foods or supplements are often necessary to meet daily requirements. Additionally, people with gastrointestinal disorders like gastritis or those who take certain medications, such as proton pump inhibitors or metformin, may be at greater risk for B12 deficiency and should consider regular testing and appropriate supplementation under medical supervision. Supplementation with vitamin B12, particularly in its more absorbable forms such as methylcobalamin, can help restore proper nerve function and may lead to improvements in bladder control and a reduction in nighttime urination. However, it's essential to understand that correcting a B12 deficiency takes time, and consistency in supplementation is key. In some cases, especially with long-standing deficiencies, it may take several weeks or months to notice significant improvements. Addressing a vitamin B12 deficiency can offer multiple health benefits beyond bladder support. Improved nerve communication can lead to better bladder sensation and timing, reducing the sensation of urgency and minimizing nighttime wake-ups. Combined with lifestyle changes such as limiting fluid intake before bed, avoiding bladder irritants like caffeine or spicy foods, and strengthening pelvic floor muscles through exercise, ensuring adequate B12 intake can be a safe and effective part of a holistic strategy for managing nocturia. By focusing on proper nutrition and understanding the body's interconnected systems, individuals can take proactive steps toward improving their bladder health and achieving more restful, uninterrupted sleep. Vitamin C is best known for its powerful antioxidant properties and its role in supporting the immune system, but its benefits extend far beyond fighting colds and infections. When it comes to urinary health and managing nocturia, vitamin C plays a valuable role in reducing inflammation, strengthening tissue integrity, and protecting the bladder from oxidative stress. For many individuals experiencing frequent nighttime urination, inflammation or irritation in the bladder and urinary tract can be a contributing factor. This irritation can increase sensitivity and reduce the bladder's ability to hold urine effectively, leading to multiple awakenings during the night. By helping to reduce inflammation, vitamin C may calm the bladder lining and reduce the frequency and urgency of urination. In addition to its anti-inflammatory effects, vitamin C also supports collagen production and tissue repair, which are crucial for maintaining the health and elasticity of the bladder wall. A strong and resilient bladder lining is less prone to irritation and better able to retain urine without triggering unnecessary signals to empty. Furthermore, vitamin C's antioxidant action helps neutralize free radicals, unstable molecules that can damage tissues throughout the body, including those in the urinary system. This protective function is especially important for people dealing with ongoing bladder sensitivity or those recovering from mild infections, as it aids the healing process and reduces the chances of recurring irritation. However, while vitamin C is generally beneficial, it's important to approach it with balance. Excessive doses of vitamin C, especially in acidic forms, can, in some sensitive individuals, cause bladder irritation or make symptoms worse. That's why choosing the right form and dose is essential. Buffered or non-acidic versions of vitamin C, such as calcium ascorbate or magnesium ascorbate, are gentler on the urinary system and often better tolerated by those with bladder issues. Taking vitamin C earlier in the day, along with food, may also reduce the chance of any discomfort. Natural food sources of vitamin C include citrus fruits like oranges and lemons, strawberries, kiwis, bell peppers, and dark leafy greens. Incorporating these into a balanced diet not only supports urinary health, but also enhances overall immune function, improves skin health, and promotes wound healing. When dietary intake isn't sufficient, especially during periods of stress, illness, or in individuals with increased nutritional needs, a supplement can be helpful. Vitamin C also contributes indirectly to better sleep quality, which is often compromised in individuals with nocturia. When the bladder is less inflamed and more capable of holding urine comfortably through the night, sleep interruptions become less frequent, and the body gets a better chance to rest and recover. This can have positive ripple effects on mood, energy, and overall well-being. While vitamin C is not a cure for nocturia on its own, it serves as an important part of a holistic approach to bladder health. When combined with other supportive nutrients, smart hydration practices, and a healthy lifestyle, it can contribute to a noticeable reduction in nighttime urination and help restore a better quality of life. Always consult with a healthcare provider before starting any new supplement, especially if you have existing medical conditions or are taking medications. With the right approach, vitamin C can be a valuable ally in your journey toward better sleep and improved urinary wellness. While vitamins can offer essential support in managing nocturia, lifestyle choices and timely medical advice are equally important in achieving lasting improvement. The body operates as a highly connected system, and nighttime urination is often the result of multiple overlapping factors rather than a single issue. This is why combining proper nutrition with mindful daily habits can lead to better control over urinary patterns and significantly improve sleep quality. One of the first and most effective changes involves adjusting fluid intake. Drinking enough water throughout the day is crucial for overall health, but it's important to taper off fluid consumption in the evening. A good rule of thumb is to limit fluids about 2 to 3 hours before bedtime. This helps ensure the bladder is not overly full during the night and reduces the need to wake up for bathroom trips. Equally important is avoiding substances that irritate the bladder. Caffeine, alcohol, carbonated beverages, and spicy or acidic foods can increase bladder sensitivity and lead to more frequent urges, particularly at night. Limiting or avoiding these, especially in the hours leading up to bedtime, can have a calming effect on the urinary system. Additionally, practicing good sleep hygiene, such as maintaining a consistent sleep schedule, avoiding screens before bed, and creating a relaxing sleep environment can help regulate the body's circadian rhythm and improve the natural release of antidiuretic hormone, which helps reduce nighttime. Urine production. Another key aspect is maintaining a healthy weight and staying physically active. Excess abdominal weight can put pressure on the bladder and pelvic floor muscles, worsening symptoms of urgency and frequency. Regular physical activity supports healthy metabolism, circulation, and muscle tone, all of which play a role in bladder function. Specific exercises like pelvic floor strengthening, commonly known as Kegel exercises, can help enhance bladder control by targeting the muscles that support the urinary tract. These exercises are simple, non-invasive, and can be practiced by individuals of all ages. Monitoring underlying health conditions is also critical. Nocturia can sometimes be a symptom of other medical issues such as diabetes, kidney problems, heart failure, or sleep apnea. If lifestyle and nutritional changes do not lead to noticeable improvement, it's important to consult a healthcare provider for a full evaluation. In some cases, nocturia is linked to medications that increase urine output, such as diuretics, which may need to be adjusted under medical supervision. Identifying and addressing these deeper causes ensures that the issue is not only managed but potentially resolved. For women, hormonal changes related to menopause can lead to changes in bladder function, while men may experience nocturia due to an enlarged prostate. In both cases, early medical guidance can help prevent the condition from worsening. Simple tests, physical exams, and even a discussion about urinary patterns can provide valuable insights and direct the right course of action. In summary, while vitamins such as D, B12, and C can form a strong foundation for supporting bladder health, they are most effective when combined with a well-rounded lifestyle approach. Drinking fluids wisely, avoiding bladder irritants, staying active, managing stress, and seeking timely medical advice are all essential components. Together, these strategies can significantly reduce the burden of nocturia and help individuals enjoy more peaceful, uninterrupted nights. Prioritizing both self-care and professional guidance is the best way to regain control and improve overall quality of life. In conclusion, frequent urination at night, also known as nocturia, is more than just a minor inconvenience. It can have a real impact on your sleep quality, energy levels, and overall well-being. But the good news is that there are natural and effective ways to support your bladder health and reduce those nightly interruptions. By understanding the role of key vitamins like D, B12, and C, and how they contribute to hormonal balance, nerve function, and inflammation control, you can take simple steps that may help restore more peaceful, uninterrupted rest. However, vitamins alone are not a magic fix. They work best when combined with smart lifestyle habits such as proper hydration timing, avoiding bladder irritants, staying active, and seeking medical advice when necessary. Every body is unique, so what works for one person may differ for another. That's why it's important to listen to your body, stay consistent, and make gradual, informed changes. If you or someone you care about is struggling with nighttime urination, know that you're not alone, and there are safe, supportive steps you can take today. A healthier bladder and a better night's sleep are absolutely within reach. Thank you for watching, and take care of your health. Because quality sleep is not a luxury, it's a necessity.